radical trend in boosting metabolism and maintaining weight is intermittent fasting. So joining us now to talk about the pros and the cons is physician and the author of Normal Doesn't Have Side Effects, Dr. Aimee Duffy. Welcome to Bloom, Doctor. How are you?
I'm fantastic. How are you? Thanks for having me.
Thanks. I'm excited to talk to you about this because I've heard some about it, but I want to know the details. What is intermittent fasting?
It is great. It is where you're going to pick a window of time where you're eating and a window of time where you're not eating. So I talk about two different types of intermittent fasting. Fasting general is the time where you're not eating, and it's really become a very popular trend these days because, one, it works for weight loss purposes, but it's also really good to reduce inflammation, improve cardiovascular risk, as well as reduce the risk of diabetes. So two different types. The first type I like to talk about is what I call the calendar way. So the calendar way is basically picking 2 days of the week, make sure that they're not 2 consecutive days in a row, and you're going to put an X there. Those are your fasting days. So you're not eating on those days, and the rest of the days of the week you can eat normal. You can also adjust this for the different weeks. So if you have an event on Monday and you want to change your fasting day to a Tuesday, you can do that. So that makes it really easy. Another way that's probably more popular and a little bit easier to start out with if you're just starting intermittent fasting is to do what we call the clock way. And the clock way is where basically you pick a window of time where you're going to start eating and a window of time where you fast. So for instance, let's say you're going to start eating at noon on today, let's say it's Tuesday, and you're going to stop eating at 6 p.m. and then you're going to resume eating again at 12 o'clock the next day. So you have this nice fasting window that's longer, and you have an eating window that's shorter. Now, the beauty of this is that you don't have to be counting calories or counting carbs or keeping track of your macros. It's not so much about what you're eating, it's about when you're eating. So if you want to have that glass of wine with your meal, fantastic, have that glass of wine. If you want to eat one of your favorite pieces of chocolate, or you want to eat the whole bar, you can go ahead and do that as long as it's within your eating window. What I do tell people, though, is that you are going to get the best results if you still choose those healthy foods to make sure you're getting your veggies, your fruits. And one of the most important things is that you got to stay hydrated during that fasting time. So make sure that you're still getting plenty of water.
Well, I liked when you pulled up the wine and the chocolate there. Those are two winning combinations in my house. I'm curious if people, right, if people go the clock route for fasting, is there a certain amount of time that this is a minimum amount of time that you have to cut off food?
Yeah, the most common is what we call the 16-8 fast. So you're eating for 8 hours and you're fasting for 16 hours. I would say that, again, that's the easiest place to start. What we see, though, in the studies is that the longer that fasting window is, the more benefit you're going to have. So you can start with the 16-8 fast, but if you can move yourself into fasting for 18 to 20 hours, that's where we're going to start to see the most benefits, particularly for health-related conditions.
You know, I feel like growing up, I always heard you should try to eat a lot of small meals throughout the day. And now this is saying just take out eating windows entirely, whether it's for hours or for a day or so at a time. So how does this help with our metabolism?
I think, it is kind of mind-blowing because that's what we used to say, eat 6 small meals a day. And the theory there was that we were helping our metabolism because when we go into starvation mode, we go into storing mode. What we're finding more and more, though, is probably a combination of how our diet has changed over time with more sugar, more carbohydrates, more processed foods. And what's happening is that we're getting high blood sugar, we're getting high insulin, and actually the fasting window gives your body time to actually go after the stored energy, the stored fat that you have in your system. So when you get past that 16 to 18 hour time window is when really your body starts to look for the stored fat. So you're going to see better results there, actually.
Well, I like that because who can keep up with the portion control or count the calories if you're trying to go with that route? So clock or calendar for intermittent fasting is the way to go.
Yep. Now I get a lot of questions from my patients, is this safe? And you're sort of going the same way, should we have more meals throughout the day, or is it safe to have this fasting time frame? And there's really two areas where we want to be cautious. One is if you're monitoring your blood sugar, if you have any one of these little glucose monitors, whether you're poking your finger, you have a continuous glucose monitor on your arm. If you are insulin diabetic, we have some caution there, and you need to be talking to your healthcare provider to make sure if you need to make any adjustments there.
I think that's always great advice. Dr. Duffy, thank you so